The survival of after transplant varies. It's not the panacea. It is kind of like trading one disease for another. And if you look at the survival of patients with IPF, here shown as IIP, idiopathic interstitial pneumonia, it tends to be worse than other disease conditions such as cystic fibrosis. It might be a function of age or the underlying lung condition. As mentioned, IPF is a disease of the elderly, whereas CF patients tend to be in their 20s, 30s, maybe 40s when they get a transplant. So whether it's underlying disease or age that factors into this difference in survival is a little bit uncertain. We like to think we are getting better with transplant as the years roll by and as we go through different eras. We're not yet where our cardiac colleagues or our hepatology colleagues are in terms of survival. But the reason that we aren't improving survival as much as we would like is because we're taking sicker patients and older patients at the same time. So hopefully we will make further inroads in terms of long-term survival in the coming years. If one looks at IIP or IPF, there is data to suggest that patients who get bilateral lung transplants do better than patients who have single lung transplants. However, one needs to be cautious when one looks at a survival curve like this because there's a certain bias here. Patients who get bilaterals, once again, tend to be younger and perhaps more robust. Patients who get singles tend to be older and maybe a little less robust. When one controls for all these other factors and does a multivariate analysis, it does appear that survivals tend to be fairly similar with singles versus bilaterals in patients with IPF.